This is Dr. Sanjay Sharma for Insider Medicine. Now, we've covered the literature, and there's a couple of stories that I think are critically important for you to understand relating to cardiovascular problems. Now, the first pertains to the heart. Congestive heart failure is a problem where the heart, as you all know, typically is a muscle. It constricts, and blood flows into the rest of the body, to the eyes, to the brain, to your intestines. Now, congestive heart failure really means that the heart is not functioning properly. Instead of being a nice, strong organ that constricts, it's more like a bag, and it just barely constricts, and very little blood gets into the rest of the organs. Now, congestive heart failure can lead to serious problems. In fact, it can cause mortality in about 25% of people per year in the advanced stages. So what do we do for it? Well, typically, if the heart gets really, really bad off, we have to have a heart transplant. And as you know, there's not many donors out there. So what's been invented is something called a left ventricular assist device. And what that essentially is a pump that is down here, and it's connected to the ventricle, the bottom part of the heart. So blood goes into the external pump and is pumped into the major artery of the body called the aorta. So researchers in Europe actually looked at this left ventricular device in 15 people with congestive heart failure and also used various medications. They were able to demonstrate that 11 of the 15 by 1 year were actually able to have enough heart function to remove that left ventricular device. So that's quite impressive. After 4 years, a significant majority of the people actually had a very healthy heart. So that's a dramatic improvement from what we've seen in the past. So for those who have congestive heart failure, there is some emerging evidence to suggest that there is some hope out there. Now, the second important study pertains to stroke. Now, stroke is it's very similar to a heart attack. In fact, some people are calling it a brain attack. And what it really means is that the brain loses sudden blood supply. So, typically people will present with weakness or numbness or tingling in their hands, slurred speech, decreased vision. Any of those are very concerning symptoms and are strongly suggestive of a stroke. So what happens is patients go to the emergency room, and doctors have to make an urgent decision, really in about a 3-hour window, to offer clot-busting treatment or not. Now, traditionally we've used CAT scanning images to help us diagnose stroke, but we don't typically see changes until about 6 hours or so after the symptoms have occurred. So, in some ways doctors are in the dark in terms of making the decision whether to offer treatment or not, because there is a downside risk to these clot-busting treatments because they can predispose to a lot of bleeding in the brain. Now, what researchers were able to demonstrate in about 70 people, they looked at MRIs. Now, MRIs are kind of like the new kid on the block for imaging. And MRIs don't use ionizing radiation. They give you very, very beautiful pictures of what's happening in the brain. Now, here's one where, just to orient you, this is like a cut right down the middle, and what we can see is this is the skull here, and inside is the brain. The tightly coiled material is the cortex. The cerebellum, which is responsible for balance and movement, is in the back of the brain. And what MRI can detect very early on is very subtle changes related to a stroke. So the researchers were able to demonstrate that within moments of someone having a stroke, there were changes related to the brain. The second thing they were able to show is they could predict who was going to really respond very well to this clot-busting treatment, which means that we know from now on who's going to respond to it. The other thing is they were able to predict who was going to get a catastrophic hemorrhage into the brain. So look for MRI for really changing the way that we manage stroke.